Today's topic is very important as it concerns the health of our blood vessels, both veins and arteries. As we know, blood vessels are pathways that carry blood to cells, tissues and organs. Through arteries, blood supplies oxygen and nutrients, while veins mainly take away metabolites, which are unnecessary substances produced by the work of billions of cells. For blood vessels to fulfill their functions, they must be open and elastic. If their condition deteriorates, it can have unpleasant consequences such as atherosclerosis, hypertension, coronary heart disease, stroke, limb ischemia, and many other diseases. That is why it is so important to take care of the condition of our blood vessels and ensure that blood flows freely through them. Unfortunately, unhealthy nutrition, living in a polluted environment, smoking, alcohol abuse, chronic stress, insufficient sleep, and existing various diseases can weaken our arteries and veins. Fortunately, there are many products and ingredients that can help us, figuratively speaking, to cleanse our blood vessels and make them elastic again. In today's video, I would like to briefly present a list of most important products that should be incorporated into the diet to improve the condition of the arteries and veins without going into too much detail. Vitamin K2 is an important component for healthy blood vessels functioning. It prevents calcium deposits from forming in the arterial wall and thus is said to prevent calcification or hardening. If there is too much calcium in the blood vessels, for example due to megadosed vitamin D supplementation or other diseases, and at the same time too little of this vitamin in the body, then the excess calcium would make the vessels less elastic, which is an easy path to hypertension and atherosclerosis. In short, vitamin K2 clears the blood vessels of excess calcium, directing it to where it belongs, the bones. This beneficial effect of vitamin K2 is confirmed by scientific research. For instance, it has been shown that people who take larger amounts of this vitamin have a lower risk of developing coronary heart disease. The best source of vitamin K2 is fermented soy grains, also known as natto. I don't think many people eat it and some may have never even heard of it. Vitamin K2 can also be found in organ meats such as liver, as well as small amounts in dairy products and eggs. Given the limited availability of vitamin K2 in food, I believe a good solution is to take it in the form of K2-MK7 along with vitamin D, especially if taking doses higher than the official recommendation, about 10,000 units a day or more. To maintain proper vascular condition, one cannot overlook vitamin E. It is a powerful antioxidant and has considerable significance. Specifically, vitamin E protects low-density lipoproteins, also known as LDL cholesterol, from oxidation. In other words, vitamin E protects cholesterol particles from harmful chemical modifications that occur in our bodies. Remember, cholesterol itself is not particularly harmful, but if it undergoes certain transformations, it can become dangerous to our arteries, namely oxidized cholesterol or oxycholesterol. The current state of knowledge also shows that vitamin E prevents the deposition of altered cholesterol particles on the walls of arteries, thereby preventing the formation of atherosclerotic plaque. Excellent sources of vitamin E include various kinds of seeds, nuts, and plant oils. Particularly rich in vitamin E are wheat germ oil, sunflower seeds, almonds, hazelnuts, or grapeseed oil. Blood vessels have potassium as an ally. When this element is regularly supplied in adequate amounts, it relaxes the smooth muscles that form the arteries, making them more elastic. As a result, the blood vessels expand, facilitating the passage of blood. This is one of the mechanisms by which potassium regulates blood pressure and helps to prevent hypertension. To ensure the right amount of potassium, we should focus on fresh vegetables and fruits, such as beans and lentils, as well as potatoes, pumpkin, carrots, kale, broccoli, tomatoes, bananas, prunes, blackberries, and kiwis. Another key component is magnesium. Like potassium, it reduces the stiffness of arteries, allowing for a free flow of blood. Its deficiency is associated with an increase in blood pressure, as well as a higher risk of developing atherosclerosis, coronary heart disease, heart rhythm disorders, and heart failure. To obtain magnesium naturally, a good solution is to use pumpkin seeds, leafy green vegetables, buckwheat, or cocoa. A good way to take care of your veins and arteries is to provide omega-3 fatty acids. Here I am mainly referring to two compounds, eicosapentaenoic acid and docosahexaenoic acid. According to scientific evidence, supplementing with omega-3 improves the function of the endothelium, which is the lining of the blood vessels. Moreover, omega-3 fatty acids reduce the stiffness of arteries and soothe the inflammatory state, which can lead to damage to the vessels. Furthermore, studies have shown that omega-3 supplementation leads to lower levels of triglycerides in the blood. This is of great importance for health, as high levels of triglycerides can contribute to the formation of atherosclerosis. All these mechanisms have a clinical effect. For example, taking omega-3 is associated with a lower risk of heart attack. The best source of EPA and DHA is wild Pacific salmon, as well as sardines, mackerel, and herring. However, if one cannot access fresh fish from a reliable source, taking cod liver oil or alga oil is a safe solution. People who want to improve the state of their veins and arteries should include products that are a source of folic acid, also known as vitamin B9, in their diet. You may be wondering what role this vitamin plays when it comes to blood vessels. Folic acid participates in the transformation of a compound called homocysteine into one of the amino acids called methionine, causing a decrease in the level of homocysteine in the blood. This is of particular importance for health, as an excess of homocysteine leads to atherosclerosis and also increases the risk of thrombosis. To provide a considerable amount of natural folic acid, which is folate, it is best to reach for leafy green vegetables such as spinach, parsley leaves, kale, broccoli, and Brussels sprouts. Legume seeds such as beans, chickpeas, and peas are also very rich in folic acid. Your veins and arteries will certainly be grateful to you if you get some vitamin C. And this is because vitamin C participates in the production of collagen and elastin, which are components that provide the proper elasticity of blood vessels. In addition, vitamin C helps to produce nitric oxide, which expands the arteries and facilitates blood flow. This has been demonstrated by scientific studies, which show that people who consume high amounts of vitamin C have a lower risk of stroke and coronary heart disease. I think most of you know where to find the most vitamin C, but just in case, here are the sources of this vitamin. Mainly black currant, citrus fruits, kiwis, strawberries, peppers, kale, broccoli, cauliflower, and cabbage. In scientific literature, we can also find information that evening primrose oil is beneficial for cardiovascular health, and this is due to its ability to lower triglyceride levels in the blood. As can be read in one research study, the use of it at about 1 to 4 grams a day is associated with a reduction in triglyceride levels by as much as 37 milligrams per deciliter. The reason why triglycerides are harmful to blood vessels was previously mentioned when discussing omega-3 fatty acids. Adding garlic to our menu could be beneficial for our healthy arteries and veins. Current research shows that garlic can prevent stiffness of arteries and inhibit the formation of plaque. Furthermore, it helps reduce triglyceride levels and lowers production of prostanoids, which are blood vessels constrictors. Additionally, sulfur compounds found in garlic or onion prevent platelet aggregation, leading to an antithrombotic effect. All this culminates in better blood flow and protection against hypertension. If you decide to consume garlic, remember to chop or mince it first in order to release beneficial compounds. Eating half a clove of garlic a day is enough to reap its health benefits. Consumption of cocoa has a beneficial effect on the vascular system due to the biologically active compounds such as catechins, procyanidins, and anthocyanins. These compounds protect the cholesterol present in the arteries from damaging oxidation, meaning the unfavorable changes mentioned previously. In addition, consuming cocoa is associated with a reduction in the levels of inflammatory molecules, thus reducing inflammation of the blood vessels. As a result, including cocoa in the diet is a good way to protect oneself from some cardiovascular diseases. For example, studies show that people who consume cocoa or dark chocolate have a 10% lower risk of coronary heart disease, 14% lower risk of heart failure, and a 16% lower risk of stroke. It is best to consume about 2 tablespoons of cocoa per day or a few pieces of dark chocolate, which should have a minimum cocoa content of 80%. Beets can also be beneficial for the vascular system due to the presence of nitrates, which cause the arteries to expand and become more elastic. Numerous studies have concluded that the arteries of people who consume beets, such as in the form of juice, are in much better shape than those who do not. This, of course, carries over to overall cardiovascular health. For example, consuming beets or juice made from them can potentially prevent heart attacks or lessen damage from a heart attack among people who have circulatory problems. Fruits from the berry family, such as raspberries, strawberries, blueberries, and blackberries, are beneficial for promoting healthy blood vessels. This is not only due to vitamin C, but also because these fruits are full of powerful antioxidants from the flavonoid group. These work to protect veins and arteries, preventing damage and the development of an inflammatory state. This relates to cholesterol, which is often demonized. Under normal conditions, when our blood vessels are in good condition, cholesterol, both dietary and endogenous, is not a problem. Unfortunately, when arteries or veins are damaged, they can capture various elements circulating in the blood which begin to adhere to the damaged site. This accumulation of different substances creates the plaque which blocks blood flow. Cholesterol is one of the elements captured by the damaged site, though it is not the only one. Calcium and immune system cells also tend to attach to such sites. It can be said figuratively that the compounds found in berries help to keep blood vessels clean. When it comes to fruits and their ability to take care of cardiovascular health, it is worth mentioning watermelon. Several studies involving people have unequivocally shown that eating watermelon is associated with improved functioning of arteries and the prevention of thickening and narrowing of blood vessels. Such an effect was observed in people with pre-hypertension, diagnosed hypertension, and obesity. These data show that watermelon can improve the state of veins and arteries for people facing cardiovascular diseases or at risk of developing them. The properties of rosemary, an aromatic herb originating from the Mediterranean basin, are invaluable. Rosemary contains carnosic acid and carnosol, which have anti-glycation properties. I will explain what that means. In our bodies, undesirable chemical reactions occur, known as glycation. Those involve, for example, sugar connecting to proteins, resulting in structural changes that can lead to many diseases. The more sugar, especially fructose, we consume, the greater the risk that proteins and fats will be sugared, leading to the formation of advanced glycation products. For instance, if sugar attaches to collagen, a protein that provides arteries with durability and resilience, it can damage blood vessels and lead to the development of atherosclerosis. Thus, consuming rosemary, among other things, can protect arteries from the harmful effects of these compounds. Caring for our vascular health is one of the most important elements of preventing many modern-day diseases, not just cardiovascular conditions. If our veins and arteries are in poor condition, it will ultimately affect our health. We can improve the functioning of our blood vessels by incorporating specific products and ingredients into our diet. The products I have mentioned today should certainly help. Also, I encourage you to watch another video on my channel about reversing diabetes, because an excessive level of glucose in the blood can also be damaging to veins and arteries. Thank you for your attention today, and I will see you next time.